This is the inferior view of the skull, that is the Norma Basalis. Now, the Norma Basalis is divided into three parts: the anterior part, the middle part, and the posterior part. The anterior part is from the alveolar arch till this free posterior border of the hard palate, and then the middle part is from the free posterior border of the hard palate till an imaginary line that we draw up till the anterior border of the foramen magnum. Now, we shall start with the anterior part. This anterior part, first of all, it has this alveolar arch of the maxilla. Then we have this hard palate. This is called the hard palate. The hard palate is divided into anterior 2/3 and posterior 1/3. The anterior 2/3 of the hard palate is formed by the palatine process of the maxilla. So the palatine processes, there are two, and they join at the intermaxillary suture. While the posterior 1/3 part of the hard palate is formed by the palatine bones, and they form the interpalatine suture in the midline. Now, these two bones, these two parts of the hard palate, they join by the palatomaxillary suture, also called the transverse palatine suture. So yeah, spinous process is protruding out of this posterior free border. It's called the posterior nasal spine, and this is the attachment for the muscle of the uvula. Then we have these ridges at the border of the palatine bone, posterior border of the palatine bone. These are called the palatine crest. Now we'll come to the foramen. This part below the incisors, this triangular part, is called the premaxilla. Here we have the incisive fossa. This fossa, this gap in the midline, it's just below the incisors. It's called the incisive fossa. We also have the greater palatine fossa, posterior lateral to the hard palate. We have this greater palatine fossa and the lesser palatine fossa. So what do these fossas, these foramens transmit? The greater palatine fossa transmits the greater palatine nerves and vessels, and the lesser palatine fossa transmits the lesser palatine nerves and vessels. This fossa transmits the nasopalatine vessels, nasopalatine nerve, and the greater palatine vessels. These structures, they supply the premaxillary part of the hard palate. The greater palatine nerves and vessels, they supply the hard palate, and these lesser palatine nerves, they supply the soft palate and the tonsils. This was all about the anterior part of the Norma Basalis. Now we move to the middle part. In the middle part, we have this posterior nasal aperture divided into two parts by the vomer. This vomer bone, it basically, you can see these two wings. These are the wings of ala. These are the ala of vomer. And then there's this rostrum of sphenoid, which articulates with the ala of vomer and forms a fibrous joint over here. We also have the middle pterygoid plates and the lateral pterygoid plates. These are the projections of the sphenoid bone, referred to as the pterygoid plates. This one is the middle, this one is the lateral. The middle pterygoid plate has a hammer-like projection. Here you can see this hammer-like projection. It's called the hamulus of the middle pterygoid plate. These are the hamuluses of the middle pterygoid plate. Then we have this scaphoid fossa of the middle pterygoid plate. This part The hamulus is basically a pulley. It acts as a pulley for the tensor villi palatine muscle, and the scaphoid fossa is where this muscle originates from. So for the medial pterygoid plate, we have the vaginal process of the medial pterygoid plate going in there, and the sphenoidal process of the palatine bone. These two, they form the, as the joint, they form the palato-vaginal canal, and here they form the, at the ala of vomer, they form the, as this vaginal process joins the vomer, it forms the vomerovaginal canal. So the palatovaginal canal, also known as the pharyngeal canal, transmits the pharyngeal nerve and the pharyngeal artery. Pharyngeal nerve is a branch of the pterygopalatine ganglia, and the pharyngeal artery is a branch of the maxillary artery. Then we have the vomerovaginal canal, which transmits the sphenopalatine artery. After this, we have this lateral pterygoid plate and the pterygoid fossa between the medial and lateral pterygoid plates. It has the medial pterygoid muscle. So the medial pterygoid muscle has its origin in the pterygoid fossa. The pink highlighted spot is the pharyngeal tubercle on the base occiput, which is the yellow highlighted part. After we are done with this part, let's come to the greater wing of sphenoid bone. This part is the greater wing of the sphenoid. This is the boundary. This part is the greater wing of sphenoid. We have the foramen ovale and foramen spinosum visible on the greater wing of sphenoid. Then this part is the petrous temporal bone. Now the greater wing of sphenoid has this foramen ovale and the foramen spinosum. What structures go through the foramen ovale? The male structures. M for the maxillary, M for the mandibular nerve, A for the accessory middle meningeal artery, L for the lesser petrosal nerve, and E for the emissary veins. The middle meningeal artery from the foramen spinosum and the meningeal branch of the mandibular nerve. These two things, they pass from the foramen spinosum. Next, we have the here. This is the spine of sphenoid. This projection just behind the foramen spinosum, it is called the spine of sphenoid. And then medial to the spine of sphenoid, we have this groove running over here. This is basically the sulcus for the auditory tube. The cartilaginous part of the auditory tube lies here and goes to the nasopharynx. So here is the auditory tube sulcus, just medial to the spine. Then this is called the, what is this? This is a fissure between the greater wing of sphenoid and the petrous temporal bones, right? Then we have this petrous temporal bone. Okay, so over here, the petrous temporal bone, the body of sphenoid, and the basilar part of the occipital bone, they join and form this foramen lacerum. Now, this foramen lacerum is basically covered by the fibrocartilage. But the interior part, so the carotid canal and the pterygoid canal, these two open into this foramen lacerum. So the foramen lacerum, it has the pterygoid canal in its interior part, and the greater petrosal nerve and the deep petrosal nerve, they join and exit through the pterygoid canal. They're collectively the fusion of the greater petrosal and the deep petrosal nerve. It's called the Vidian nerve, or the nerve of the pterygoid canal. And then we have the emissary veins piercing the covering of fibrocartilage on the foramen lacerum. Now, this foramen lacerum, the carotid canal also opens into the foramen lacerum. Now this carotid canal, so the carotid canal has the internal carotid artery and its sympathetic plexus. every artery has its sympathetic plexus. The same way the carotid artery, internal carotid artery, also has its sympathetic plexus, and this internal carotid artery does not travel through the foramen lacerum. It passes over the foramen lacerum and into the cavernous sinus. So this was the petrous part of the temporal bone. Now we come to the tympanic temporal. This is the tympanic part of the temporal bone. This is the curved C-shaped plate, the tympanic plate, that forms the boundary of the external acoustic meatus. And then we have this vaginal process of the tympanic temporal bone that covers the styloid process, which is a sharp needle-like projection of the temporal bone. So the vaginal process covering this. Then we have the tympanic plate and the external acoustic meatus. We also have this spine of Henle. It is used to this projection basically at the anterior border of the suprameatal triangle. We have this spine of Henle. Then we have the squamous temporal bone. So the squamous temporal bone, if we look from here, okay, this part is the squamous temporal bone. It has a suprameatal crest. Let's just move the skull like this so that the suprameatal crest can be seen properly. So this is the suprameatal crest. This is the spine of Henle that we were talking about. This is the spine of Henle, and then you have the fossa for the mandible. Here there is the fossa for the mandible with the anterior tubercle. It prevents dislocation of the mandible when we open a jaw like that. So like here we have the mandible. As we open our jaw, the mandible moves here, right? So the anterior tubercle prevents the dislocation. We also have this between the squamous part of the temporal bone. So between the squamous part of the temporal bone and the tympanic part of the temporal bone, we have this fissure, the squamotympanic fissure. And here we have the chorda tympani nerve, the branch of the facial nerve that carries the taste sensations. It emerges from here, this squamotympanic fissure. So now this imaginary line on the anterior boundary, this is an imaginary line that we are creating just on the anterior boundary of the foramen magnum. So this foramen magnum, what does it do? It separates, this is a very large aperture over here. It separates the occipital bone. This is the entire occipital bone. It separates the occipital bone into the squamous part, the condylar part. These two projections, circular, they are the condyles of the occipital bone. This the basilar part of the occipital bone. So the foramen magnum is dividing this occipital bone into the basi-occipital, into the condylar parts of the occipital bone, the lateral parts, and the posterior squamous bone. Now, just posterior to this, in the center, we have this external occipital protuberance. This protuberance that you see over here, this is the external occipital protuberance, and this part is the external occipital crest. The squamous part of the occipital bone has the superior and inferior nuchal lines. The superior nuchal line, the inferior nuchal lines. Now, we go to the lateral parts of the posterior part of the Norma Basalis. So this is the condyle in the lateral part. These are the occipital condyles. Just anterior to the occipital condyle, we have this foramen, the anterior condylar canal, which is called the hypoglossal canal, transmits the cranial nerve 12, and the posterior condylar canal, which transmits the emissary veins and the meningeal branch of the occipital artery. Then we have the jugular foramen over here. This jugular foramen is formed by the posterior boundary of the petrous temporal bone and the interior part of the occipital bone. So this forms this irregular space called the jugular foramen. What passes through this jugular foramen? It's the cranial nerve 9, 10 and 11 and the cranial part of the 11th nerve and the internal jugular vein. Then we have the styloid process, which we already discussed. It's a needle-like projection, sharp projection of the temporal bone, marks the inferior most part of the temporal bone. We also have the mastoid process over here. So this mastoid process, which all of this is a part of the all the structures over here are the part of the posterior Norma Basalis, right? Now this mastoid process, it has this groove for the occipital artery, this mastoid notch, the digastric notch, where the digastric muscle arises, the origin of the digastric muscle. We have the stylomastoid foramen between the styloid and the mastoid. It transmits the facial nerve and the stylomastoid artery. Hey, this part is the mastoid foramen. Transmits the meningeal branch of the occipital artery and the emissary veins. Last part is the structures passing through this foramen magnum. The ligament, there are two kinds of structures, the ligaments and the nerves and vessels. So the ligaments are the tectorial membrane, the alar ligament and the apical ligament of dens. Then we have the medulla covered by the meninges and the vertebral arteries and the anterior and posterior spinal arteries, as well as the spinal part of the cranial nerve 11. These were all the structures that passed through the foramen magnum, the important ones, and this was all about the Norma Basalis.